Hi, my name is Max Zubatsky. I'm the director of the Medical Family Therapy Program here at St. Louis University and the director of the Family Center for Healthy Aging. I'm also the co-investigator on our HRSA Geriatric Workforce Enhancement Program grant that offers several trainings and initiatives to St. Louis and the surrounding areas in our community. In today's series of videos, we're going to go over the clinical aspect of how to share information across all of the 4 stages of the framework. We focus on this because it's often challenging for providers and professionals to know at what stage of dementia the appropriate referral and 4 M's that you want to cover at that stage. So we're going to cover this content and also show a simulation so it'll help practitioners know how you can roll this out in practice. So the first stage we're going to cover is the screening and mild cognitive impairment stage. This is often when we detect for early symptoms or risk factors for someone with memory loss. And these are often difficult because as part of a larger screening or yearly assessment, memory is just one of many health factors and conditions that we look for in keeping older adults healthy. So at this stage, a key component of the assessment is called the Rapid Geriatric Assessment that we use here at SLU. As you'll see in this video in a little bit, Dr. Sanford uses the RGA to assess for different geriatric syndromes and comorbid issues that happen for older adults in practice. So within the 4 sections of the RGA, you're going to see frailty, sarcopenia, nutrition, and cognitive assessments that the provider asks about the older adult. For sarcopenia, it's really about overall muscle strength. So there's a series of questions to really assess for the stamina that the older adult has in different situations. Frailty is looking for fall risk prevention. So in situations where the older adult remains safe in their home or in the general public. For nutrition, it looks at the habits of nutritional and dietary habits that older adults have regarding number of meals and the overall appetite that they may have. And finally, in the rapid cognitive assessment, it's a short series of questions that looks at the recall and overall memory screening for an older adult. So here you'll see Dr. Sanford work with the patient and caregiver in a sample session.
Hi, I'm Dr. Sanford. It's nice to meet you.
Hi, I'm Terry. This is my niece, Nicole.
Hi, I'm Nicole. Nice to meet you.
Yeah. What brings you in today?
I need a new GP.
And we wanted someone who specializes in geriatric medicine, so...
Great. Usually on the first visit, I administer some geriatric screening tools just so we can get a baseline and see kind of where you're at. It's a kind of a brief test, but there's about 4 different smaller tests within this test. We're looking for frailty. You may have heard of that before. Sarcopenia or loss of muscle, because that may present problems with you being independent in the future. We also look and screen for weight loss. And then everyone's favorite, the cognitive test, where we kind of see how your memory is.
These are just questions, right?
Yeah, these are just questions, not pass-fail. We'll start with the memory test. This is everyone's favorite. I'm going to give you 5 objects to remember. So I'll say them, then I'll ask you to repeat them, and then I'll ask you about them in a couple minutes. Apple, pen, tie, house, car. Can you say those?
Apple, pen, tie, house, car.
Great. So just store those. The next is a story. I'm going to tell you a story and then ask you a question afterwards. If you need me to repeat anything, let me know. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. What state did...
Chicago.
Now we'll return to those words. Do you remember those 5 objects we said together and you said out loud?
Apple, pen, tie, and... Ooh, I don't remember the other 2.
Well, thank you. We'll move on to the screening for weight loss. This is called the snack appropriately. How is your appetite? Would you say it's very poor, average, good, or very good?
Average.
Yeah, average, yeah.
How does food taste to you? Very bad, bad, average, good, or very good?
It depends who's cooking. Average, I guess.
Sure. When you eat, do you feel full after eating only a few mouthfuls, after eating about a third of the meal, after eating over half of the meal, after eating most of the meal, or do you ever feel full?
Oh, most of the meal.
Okay. And normally, how many meals do you eat in a day?
Oh, 3?
It's usually more like 2, like 2 meals,
2 and a snack.
two and a snack.
Good to know. Okay. Let me tally these up here. Again, these aren't pass fail. It just kind of gives us a baseline and idea of where you're at. So with the snack, the one that screens for weight loss, you scored 13 out of 20 points. So it's just something we're going to look at because it does indicate that you're at risk for losing weight. And the next one we did was a rapid cognitive screen. It looks like you've got 7 out of 10 possible points there, meaning that there is a little memory impairment, which is something we'll definitely address next visit, perhaps with a screening tool that's more comprehensive called the SLUMS. And, see if you notice any changes with your memory, and we'll definitely talk again next visit about that. I was so nice to meet you today. We'll follow up again at the next visit, and feel free to email me or call in the meantime if you notice any issues or have any concerns.
As you can see in this clip, Dr. Sanford worked with the patient and the caregiver, not only assessing for different areas of cognition and health in the patient, but also offering some resources and next steps for their plan of care. In an RGA, if there is a high signal and risk for cognitive impairment, the provider will often follow up with the St. Louis University mental status exam to really get an in-depth view of some of the memory challenges going on with a patient. Should that score fairly low, the physician may suggest a medication option, further follow-up testing, and talk to the caregiver about any resources or supports that they can find in the community. It's often beneficial to have a family-centered approach, especially at this early screening and mild cognitive impairment stage. When we get to the second phase in the early diagnosis phase, this is after a formal diagnosis has been given and the patient and caregiver have this information from their provider. If the patient is on medication for memory loss conditions, we want to offer additional options so that the patient and caregiver feel comfortable that memory loss is being screened effectively and we're addressing other health issues that can come into play. So as you'll see in this following clip, Dr. Sanford talks with the patient and caregiver about some additional early options to get additional areas of assessment for their health and well-being.
Hi, is Terry there, please?
This is Terry.
Hi, Terry. It's Dr. Sanford. How are you?
I'm good. How are you?
Good. Did I catch you at a good moment?
Yeah, actually, Nicole is with me.
Oh, hi, Nicole.
Hi.
I was thinking about you guys and thought I'd give you a call. The mobile van, the van that does the geriatric assessments, is going to be near you. And I was just wanting to call and give you a little information about it. I think it might be a really good thing for you guys to try to schedule an appointment. So the mobile van does comprehensive geriatric assessments, and it's interdisciplinary, meaning there's different disciplines. So there'll be a physician there, there'll be a social worker there, physical therapy is usually there, occupational therapy, social work, a nutritionist. All of the specialties are there sort of under one roof, and they all will meet with you and kind of give you a recommendation plan based on what they see your needs might be. People that I send to this love it, and they get a lot of helpful ideas on, how to age in place successfully and ideas on how to help with memory loss and other challenges that older adults face. Does this sound like something that you might want to try or that I can refer you to?
Yeah, can Nicole come with me?
Sure. Actually, they would love for her to be present because maybe she can provide a little bit more history or, sees things in a different light, and they love to get different perspectives.
Can you write this down? Yeah, I can write this down. So just to kind of summarize that, we can go to this mobile van and they'll give us a lot of really good information and maybe do something with my aunt.
Yes. And they'll actually provide you with a written summary at the end. So that will be helpful. You can take that home or, take that to other specialties that you're seeing.
Great. I hope the test not too hard.
Oh, they won't be too hard. Again, not pass fail with these cognitive screening tests or the other tests. We just really want to get an idea of where you're at and how we best can help you age successfully.
Great. That sounds great.
I have one more thing. The other thing I thought of is we also have a clinic called the 4Ms. And the 4Ms are what matters most: mobility, mentation, and medication. So these tend to play a part in how to age successfully, all of these 4 things. And so we opened up a clinic recently that addresses each of the 4. And you might actually want to go check that out too, especially the what matters part. That will really help us get to know what's important to you. So if it's okay with you, I'll refer you to that as well, just so we make sure we cover all our bases.
That sounds great. We'd love that information. Does that sound good? Yeah. Well, okay.
Okay, great. I'll get those referrals fired off. And thanks for chatting with me. Enjoy the rest of your visit together today.
Thank you. Thanks, doctor.
Take care.
Bye.
Bye-bye.
As you saw in this clip, Dr. Sanford had an effective phone call with the patient and caregiver around their next steps and plan of care. So during this stage, it's important that the provider offers plenty of community resources and options for them to take advantage of being proactive about their health. One of the options that Dr. Sanford talked about is the free community mobile health van. There's several of these types of vans throughout the country that have free screenings that have a comprehensive approach to look at other aspects of older adult health outside of just memory loss. Because as we know, other health conditions, if they decline, can impact cognitive impairment considerably. So these are some important tips when you get to this stage that a provider should offer to the family. So now we'll cover the third phase, which is the mild to moderate stage of dementia, where we really want to focus on mentation and how to keep the individual active around their cognitive skills and where the caregiver can really attune to these areas for their loved one. It's really important that the provider starts to monitor signs and symptoms so that the patient and caregiver can be aware of these at home while engaging in their community resources to make sure that they're active and still thriving. One of the most popular referrals that we offer is an intervention called cognitive stimulation therapy. This is an evidence-based intervention that's been shown really great results for those at the mild to moderate stage to engage very well in a psychosocial group environment. So in this clip, you're going to see Dr. Sanford talk with the patient and caregiver about some options, including CST in the community. She's then going to bring in our behavioral health professional, Aline, to talk a little bit about what the group entails and to make the patient and caregiver feel comfortable that this is a safe and effective option.
It's so great to see you both again. How have things been since the last visit?
Okay. I've definitely been noticing some more memory loss, a little bit, harder time remembering things, just in general. I think.
What other things have you noticed with the memory?
Having a hard time, remembering details from a few hours ago, a few moments ago. I think also just in general, a little bit of like a behavioral change, if that makes sense.
Yeah. Since the last visit, you were seen at the mobile van, is that right? The team did share their findings with me, and they did the fuller memory screening test called the slums, and the score did decrease a little bit from that first test that we did the first visit. And so based on these findings and what you're sharing with me today, I do have a recommendation for you. I think you'd be perfect to try the cognitive stimulation therapy. I think that would help with your memory.
Is that going to hurt?
It is not. I think you'll like it a lot, actually. It sounds like you're a fairly social person. You'll get to socialize there, too, and it will help with the memory. It's a group, actually. It's a group session, and we have a behavioral consultant in the office today who specializes in cognitive stimulation therapy and who also works to support caregivers. Would it be okay if I went and talked to her and had her come in and meet with you both?
Oh, okay. Do you think I should?
Yeah, I think that's a good idea.
Okay.
Great. I will run and get her, and I'll be right back. Hi, Aline. Do you have a couple minutes to talk to a patient that I just saw? The patient's name is Terry and her caregiver's Nicole. They visited the mobile van a couple months ago and had a slums. And prior to that, they had a rapid cognitive screen in the office. And we noticed a little bit of decline between the two memory test screenings. And today they're presenting with some more subjective memory complaints. I think she'd be a really good fit for CST, and they're interested in the process if you had a couple minutes to share with them.
Yeah, sure. They seem a great fit for CST. Anything else you would like me to talk with them?
I think it's probably time to give them some caregiver resources if you have anything available.
Yeah, sure.
Thank you so much. I will show you to the room and I can introduce you.
Yeah, okay.
I wanted to introduce you to Aline. She's one of my colleagues, and she specializes in cognitive stimulation therapy. Do you have any more questions for me? Otherwise, I'll let her take it over.
I think we're good. Thank you so much for your help, doctor.
No problem. I look forward to our next visit.
Thanks. Ben.
Hi, Terry. Hi, Nicole. Nice to meet you. I'm Aline. I'm part of the medical family therapists here in the clinic. Dr. Sanford informed me that you may be interested in CST. Is that correct?
Yeah, that's right.
Okay. Do you have the information about it, or would you like to share a little bit more about it with you?
Yeah, we'd love to learn a little bit more about the group. Yeah.
Okay, perfect. So CST is a group that happens in the intention of improving memory issues and also helping socialization. How does that sound to you?
That sounds good.
Can she come with me?
Yeah, sure. Usually caregivers bring their loved ones to the clinic and they don't join the group because they perceive it's more beneficial to have you by yourself with other members so you can work on your memory and socialization. But frequently we have at the same time the caregivers group, so both of you can do something that is very interesting at the same time.
Okay. Yeah, how often does the group meet?
Yeah.
Actually, do you mind if I take
Yeah,
notes?
sure, go ahead. Yeah, so we have weekly meetings, so it's once a week. People meet for 14 sessions to complete the CST, and some people like so much that they decide to do the maintenance group, so it can be a bit longer.
That sounds great. What do you think?
Yeah.
Okay. Do you have any other question?
No, I think we're good. Well, how do we schedule?
Yeah, sure. So I can talk with Dr. Stanford so we can coordinate everything together, but we can give you some referrals so we can start as soon as possible. How
Okay.
does this sound to you?
That sounds great.
Okay,
Okay.
perfect.
Thank
Yes, thank you.
So, this was a great illustration of how a provider can offer community resources and options to a patient and their loved one in a session. As you saw here, Dr. Sanford talked about the CST option to the family, describing it and making sure that they feel comfortable with it being an option outside of their routine appointments. In that second clip, Dr. Sanford and Aline, our behavioral health provider, had a wonderful consult in the hallway about the background of some of the concerns of the caregiver and patient and talking more about CST and bridging some of those gaps. When all of them returned back into the room, they had a comprehensive conversation around this, and Aline even talked about ways that she could follow up and get the family referred into a community group. So that was a perfect demonstration of collaborative care around a community resource for someone with mild to moderate dementia. We've now reached the final stage in the Dementia 360 framework wheel, which is end of life phase for those with more advanced dementia symptoms. This is a really difficult phase, not only for the provider to have to handle, but also the caregiver making some really tough decisions for their loved one. In addition to all of the 4Ms that we covered, mobility and fall risk prevention are going to be at a precedence to make sure that someone with memory loss symptoms that are more advanced feels comfortable and safe in their home. So you'll see in this clip, Dr. Sanford is going to talk with the patient and family member about some realistic options around long-term care or staying safe in their home. These are often difficult conversations that the provider has with both the patient and caregiver in session. But it's really important to lay out these options so they have the best plan of care moving forward, and that the provider is assured that the caregiver feels supported in this process.
It's so good to see both of you in the office again. How have things been going since the last visit? You did CST, right?
Yeah.
Is that right?
Yes, we did the CST, and I think she really enjoyed it. He really enjoyed it. It was good for her. I think it was also especially good for me. I don't think I realized how much strain I had been feeling just as a caretaker. And so, yeah, it was really good experience, I think, for both of us. But unfortunately, I feel like she continues to decline. And so at this point, I don't really know how to support her and, and give her the support that she needs right now.
I understand. This is a hard journey. It really is a journey. I hope you don't mind that we're going to talk a little about you, but feel free to jump in if we say anything that's not correct.
Okay.
How much oversight is she getting at home right now?
I'm trying to check in on her every day. And then we have a neighbor friend who checks in on her, is helping to make sure that she's eating her lunch and sometimes dinner. But
Okay.
I'm really not sure how much she's actually eating throughout the day.
But that's really worrisome to you. I imagine you worry about that a lot.
I do.
It's probably hard to sleep at night too.
Yeah. I'm speaking of sleep, I'm not sure how much she's sleeping. She seems kind of really tired and out of it most of the time.
Okay.
So, yeah.
Based on, what the mobile van, the memory test results of that, and kind of what I've learned from the group that was doing the CST, I think we're kind of at one of those points that maybe we should talk about getting some more oversight. I'm not sure about our financial resources, but more oversight in the home, or else considering maybe a move to a higher level of care that would provide that safety and oversight. What do you think?
I don't really know anything about those types of care facilities. Would you be able to just tell me a little bit more about what that could look like?
Sure. There's each facility is different. I'm not quite sure yet if I would recommend assisted living or more like a nursing home or memory care. But I will say in general, the facilities tend to have more of a structure. So someone will be helping her with her activities of daily living, helping her get up and get dressed and, get to breakfast. All the meals are usually provided on site. There's also a lot of amenities that you could take advantage of. I hope you don't mind that we're talking about you. Feel free to jump in and, share any of your thoughts too as we're talking through this. But yes, they have amenities like a beauty shop, or if you like to get your nails done. There also are a lot more opportunities to socialize at, these places that than what she has at home probably. So lots of activities you can choose from. I'm sure we could find something that you like to do. And I think it would probably give you a peace of mind. So you're not worrying when you go to sleep at night and not worrying, that she's fallen and laying there. I do have a social worker in clinic today. I'd be happy to send a referral and maybe she could get you a list. Even if you find you're not ready quite yet, I do recommend going and putting your name on wait lists. Some of these places have long wait lists, and just kind of getting a sense of what area of town you like, maybe touring some places, taking her with you, seeing what might be a good fit.
Yeah. A place that would be close to us, close to me.
So you can visit.
Yeah. So we can visit. That'd be great.
Okay. Well, let me put this referral in for social work, and I'm here with you on this journey. So we'll keep, in touch, and we'll work through any obstacles you face.
Thank you so much.
You're welcome.
So in that clip, Dr. Sanford did an effective job talking with the patient and the caregiver around end-of-life decision-making, not just around how to manage dementia symptoms, but in the home environment and keeping them safe. For families that want to keep their loved one at home, there are specific caregiver considerations as well as family supports that they need to keep in mind. If there's a relocation to a long-term care or skilled care facility, it's important for the physician to provide these options to the family so they can make the best possible choice around access to care, financial considerations, and the best living situation for their loved one. So it's important that the physician coordinates with their care team to make sure that the patient and caregiver feel safe and comfortable with their decision, whether to remain home or to relocate to another care facility. Coordinated care in this day and age is really important to work with this population, especially with end-of-life issues related to dementia. Thank you for watching this information on the Dementia 360 framework and as we progress through the stages of dementia as a whole. We hope you found this valuable in learning not only what to consider in the signs and symptoms, but also the referrals and types of provider communication that are necessary at these stages. The clinical application and skills in these videos can apply to a number of medical professionals that are seeing patients and caregivers going through dementia symptoms, including primary care physicians, geriatricians, nurse practitioners, medical assistants, and others that are involved in the care team. So we hope you found this information valuable in your routine practice, and please touch base with us for any additional questions. You can also refer to the Family Center for Healthy Aging website that has more information about all of our referral strategies and assessment interventions as well. Thank you so much, and we hope you continue to serve older adults in your respective communities.